That's great. Thank you so much, Hope. I hope everybody can hear us. Please just send a message in the chat if you can't. And again, I apologize for the delay. This is our first time doing a webinar like this. And we had thought we had the tech stuff worked out a little earlier, but it always last minute challenges. So just to introduce myself, I'm Freya Arneson, and I'm the project manager for RITHIM, which is research improvements through harmonization in Manitoba. This is our first webinar, and I really want to thank you for joining us. We're excited to have Dr. Chandra Kavanagh with us today to tell us all about the data management framework she has created and the changing landscape of data management in Canada. Before I officially introduce Dr. Kavanagh, I want to provide some context for today's presentation. I've been fortunate enough to attend one of Chandra's presentations at the CARIB conference and to have met her in St. John's last fall at a modern consent design workshop. We invited Dr. Kavanagh to share her work and expertise today because we wanted the research community in Manitoba to have the chance to learn about the framework and the tools that she has created. I want to highlight that this is an opportunity to learn about some of the changes that will be coming at a national level. And to be clear, RITHIM doesn't have any specific requirements regarding the use of the tools that you'll learn about today, but we think that they could be an important resource for researchers in the province, especially considering the fact that Tri-Agency will soon be releasing an official policy regarding data management plans. So these adaptable tools that Dr. Kavanagh has created could assist researchers in meeting the new requirements. Our hope is that through today's presentation, you can gain an understanding of some of the upcoming changes regarding data management at the national level, and that you get a chance to learn about the toolkit Chandra has created, and that we provide an opportunity for you to ask questions. So at any time during today's webinar, we encourage you to type in questions for Dr. Kavanagh through the chat function, and these will be moderated. So with that, it's my pleasure to introduce Dr. Chandra Kavanagh. She's the ethics officer for the Newfoundland and Labrador Health Research Ethics Authority. She's also a PhD candidate in the philosophy department. Oh, sorry, this is my old one. She teaches biomedical ethics at the Memorial University of Newfoundland and Labrador, and Chandra received her PhD in 2019 from the philosophy department at McMaster University, where she studied biomedical ethics and feminist philosophy. Chandra's presentations on political and ethical issues have received high acclaim across Canada, the United States, Europe, and Australia, and she's been widely published in both academic and popular media. A major force for ethical digital data management in Canada, Chandra runs a national working group for the implementation of ethical and responsible data management best practices, and she's served as a digital ethics advisor for McMaster's Research and High Performance Computing Support Group. So with that, I would like to welcome Chandra, and I'll turn it over to her.
All right, well, thank you so much for that. My apologies to everyone for this a little bit of a challenging beginning, but hopefully we'll get off on a better foot now. So I'm looking forward to chatting with you a bit. Actually, maybe we can move to the first slide. Sorry, guys, do you think we can move over to the first slide?
There's just a little delay, but it should show up in a second.
Okay. All right, still seeing a little bit of a delay on my end, so maybe I'll work with the one that I have here. So taking a look at the objectives for today. So first, I'm going to give you a bit of an overview of Canada's data management landscape. So this is something that is changing rapidly right now. So this is something that I think will be of interest to folks for a number of different reasons. So I'm looking forward to going over that with you. We'll then talk about the TCPS2 data management requirements so that we brought up. Those are big changes. They're going to affect universities. They're going to affect other kinds of research-oriented organizations. So having a good sense of what's happening on the ground is going to be something that I think is very useful. Then we're going to talk a little bit about what it takes to put together a great data management plan. I'm going to talk to you about a tool that will help you do that. And then finally, we'll talk a little bit about the data management toolkit. So first I want to let you know that I still, as a kind of university professor, am getting used to the idea of presenting a lot of my content online. And one of the things that I find I don't love about the online format is it kind of prevents a level of conversation that I really miss in the classroom. So I encourage everyone, if you have any questions, feel free to stop me, feel free to interrupt me, and I'll have a couple of conversational prompts as well along the way. All right, so we'll move along to the next slide. So starting with Canada's research data. So what does the research data management look like today? So in the next slide, we talk about the digital research infrastructure. So digital research infrastructure is the collection of tools and services that allow for researchers to turn their data into major scientific breakthroughs. And so as it stands right now, Canada has a digital research infrastructure, but that infrastructure, as we're going to see, is pretty piecemeal. And there are some rapid changes that are happening with regard to that infrastructure. So moving on to the next slide, we've got 4 key elements. So the 4 key elements of a country's digital research infrastructure include some of the following things. So a digital network for research and education, allowing researchers to share data and collaborate across Canada and around the world. The second one is data management, so the way that we manage our data and the supports that are put in place to find and access our data. We then have research software, so this enables researchers to access and use their data. And finally, advanced research computing involving supercomputers and the technology that's required analyze massive amounts of data. We see this all over the place. We really see universities increasing their capacity when it comes to analyzing these massive amounts of data. Where I notice that in my job every day is with genetic research. So just huge volumes of data that's tremendously valuable if it can be analyzed properly. So moving on to the next slide, the current national digital research infrastructure landscape. So essentially, this is something that was put together by the federal government to say, hey, what does our digital research infrastructure look like now, and how do we want it to look? So starting with how it looks like now, we've got the Government of Canada that oversees all of these different groups. Then we've got Canary, which is a group that's responsible for the digital network for research and education. We've got Research Data Canada that's involved in data management. We've got the Canadian Association of Research Libraries that's involved with data management. We've got the Canadian Foundation for Innovation, which is involved with research software. We've got Compute Canada, involved with advanced research computing. And if you think that this looks complicated, this is just the tip of the iceberg. We have a million different little data repositories out there. We've got a million different little not-for-profits and organizations that are involved in this digital research infrastructure in our country. And so the decision was made at the federal government level that there were going to be some changes that were made to kind of create a more coherent ecosystem when it comes to how research data is managed and treated. And they have put hundreds of millions of dollars into the update of this infrastructure. And in fact, this tremendous update to the current national landscape, to the current national infrastructure is happening right now. So if we move on to the next slide, you can see the future national digital research infrastructure landscape. And really future is beginning to mean present because there are a number of changes that have just happened. So essentially, instead of having all of those little organizations who are working together or not, the idea was to put together what they're calling NDRIO, or a new digital research infrastructure organization. And this major organization is intended to oversee all of the data management, all of the research software, all of the advanced research computing that's happening in the country. Of course, universities and other research institutions are still going to play their role, but in terms of this sort of expanding plethora of organizations that have had a role to play in this in our current national digital research landscape, the idea is really to amalgamate all of those organizations. And so this new DRI has been in the works for quite a long time. And as it stands right now, they are currently beginning to operate. So they're in the process of hiring their executive director. They're in the process of hiring their staff. Their board of directors was formed quite a while ago, and they are instigating the process to really start this organization off. So now is an opportunity. If you have an interest in ethical digital data management, if you have an interest in responsible data management, now is a real time of opportunity in this country for big, big changes. So we'll take a look at the next slide where we have where we have a definition of the new Digital Research Infrastructure Organization. So the new NDRIO is what they've been calling it. So NDRIO is a national not-for-profit organization that is playing a critical role helping to advance the establishment of a researcher-focused, accountable, agile, strategic, and sustainable digital research infrastructure ecosystem for Canadian researchers. So a big, big deal that this organization is finally happening, and also, frankly, quite disruptive to the current ecosystem in a number of different ways. So on the next slide, we have NDRIO pros and cons. So NDRIO's mandate is critical to all of Canada's academic researchers, our country's ability to remain globally competitive, our collective ability to benefit as a society as a whole from research. So out of curiosity, I was wondering if anybody about what might be some benefits of having this new organization, and also possibly what might be some drawbacks of moving toward this new organization. So did anybody out there, has anyone ever heard of this? And upon hearing of it, does anybody have any thoughts? All right, I'm not seeing any in the chat, but I know there's a bit of a lag, so I'll give it another minute. Okie doke. All right, so we'll move on to the next slide. So the next slide is titled Pros. So although there are lots of disruptive possibilities that are associated with the new organization, I think that by and large, there are many, many advantages to the existence of this new organization. So starting with the first pro, Canadian researchers will have the tools they need to conduct leading edge research. That's a big part of NDRIO, is offering the kind of analytic tools required to make the best use of data. The next pro and the next slide that we'll be talking about is researchers will be better equipped to be able to optimize research data to generate cutting edge knowledge and ideas. So again, we're going to have these tools, we're going to have an ecosystem, we're going to have a community that allows for researchers to optimize things and really keeps all of the information about this ecosystem in one place. Because that's one of the things as an expert in this field that I found the most frustrating, and that researchers find the most frustrating, that the information is so siloed and so piecemeal that often people don't know where to go to get access to a high quality data repository or to get access to high quality analytic tools. All right, and on the next slide, we will have world-class digital tools and services that enable collaboration and leverage research data to gain new science and research insights. So making use of those world-class tools as well as the capacity to collaborate. The next slide, we talk about a cohesive national vision for future investments, leveraging contributions from federal, provincial, institutional, and private sector resources. So this is hugely interesting to me, in part because especially the private sector very often gets left out of the conversations that we have around research data. And one of the things that this new DRI organization will allow us to do as a country is put ourselves in a position where we become an attractive place for investment because it's easy, it's straightforward to be able to access data and be able to make good use of it instead of having to go through a multiplicity of small organizations as well as a multiplicity of possible permissions processes instead of just going to one overarching organization. And then the final pro I have here is an agile and responsive DRI system that is able to efficiently and effectively respond to emerging needs and opportunities within the research community. So for instance, if we want to think about COVID-19, so this current health crisis that our country is facing, if it were the case right now that somebody wanted to take information that had already been collected and use that information in a research study regarding COVID-19, they might have to go to 10 or 15 different places to get access to that information. And that might be 10 or 15 different kinds of permissions processes. They might be getting different responses from different groups. The quality of data may be different depending on where you're pulling it from. And so the intention of this organization is really to make sure that that is cohesive across the board. So finally, the next slide I have is called Your Data, Your Choice. So there's a little video on this slide, and this video
Chandra?
is really, yes?
I'm sorry to interrupt. Maybe before you get into that slide, we have quite a few comments. I'm not sure if you can see them. If you can't, I'm happy to read them to you, but they are in the published section of the comments.
Okay. So I've got 30-second lag on the slides. More efficient workflows and funding streams possibly? Yes, absolutely. So I think that more efficient workflows is going to be a given. One of the things that I've noticed looking at this ecosystem and working within this ecosystem is even people who are experts in the field don't know all of the organizations that exist and how they work. So every time I go to a conference, every time I give a presentation, I hear about a new data repository. I hear about a new, research and high performance computing center. I hear about something that I've never heard of before. And so making workflow more efficient by putting it all under an umbrella organization. And then I think that absolutely leads to funding streams that are more efficient and funding streams that speak more directly to the actual needs of Canadians and the actual needs of researchers. So I think that's a really good point. Getting the voice of those in rural Canada who may not be represented. Absolutely, I think that that's excellent. And one of the things to do there is just in terms of visibility. So when you have a large, well-funded organization, it makes it more accessible to people who wouldn't necessarily be in the know about every small little organization that exists. And if you're in a major center, then you may have a ton of major data repositories. Your own institution may have a data repository. But if you're in a small town or if you're in a rural place, then you may not have access to that information. So having something that's much more sort of obvious, that's much more straightforward, that's bigger, I think would definitely allow us to include those groups. Standardization would be a plus. Word, Heather, I could not agree with you more. If you're trying to access data from some of these data repositories, or if you're trying to use some of these tools, the regulatory requirements or even just the policies can be radically different from organization to organization. And so being a person who works in research ethics and is familiar with the research ethics review process, I can tell you that nothing, infuriates a researcher more than being told one thing from one ethics board and another thing from another ethics board. And it is exactly the same when it comes to responsible data management. The next one here looks so useful. How do you think the drawbacks? I agree. I think when it comes to a lot of the drawbacks, Marion, if I'm being completely honest, and not to hate on people who are in the industry because there are wonderful, brilliant people who are currently in this field right now, but I think we end up in a situation where there is a little bit of protectivism. So people are protective of their, fiefdom, of their kingdom, they're protective of their organization and the work their organization does. And so it can be hard to think, hey, we're going to give up this view of our organization to another bigger organization. But I would say by and large, it's been very, very well received by the community. So there are always those who are not super happy, but I would say that by and large, it's a great stride forward for this country. Not sure where we're supposed to post questions. So Anonymous, I think you figured out where to post questions, and this is the place. Okay, great. All right, I worry about the ethical implications. To this anonymous commenter, that is a very, very good point. So there are a couple of different things that I have to say about that. So one, I think that there are tremendous ethical implications that are associated with this. But two, I think those ethical issues are already coming up, and frankly, in my experience, they're being dealt with very poorly. So an example of that would be the requirements that are associated with medical journals for researchers to provide their data. So as it stands right now, for many, many medical journals, it is a requirement that you provide at least some set of your data, de-identified or otherwise. However, when it comes to the typical consent form, and I see these kind of consent forms all the time, they will have language that's associated with them that says something like, only the principal investigator and research team will ever have access to your identifiable data. So we're in a situation where the way we treat our data has moved on, but the information we provide to research participants has not. And so what happens is we're not getting the informed consent that we need. And so I think that one of the benefits of having this overarching organization will be that we can kind of get up to speed with how we're treating our data, where we're storing our data, what we're doing with it, who we allow to have access to it. And we're going to be able to take that information, to take those policies that now kind of unilaterally govern the space, and ensure that we're appropriately consenting people so they actually know what's happening with their data instead of being in the dark about what's happening with their data. And in fact, this is a really, really nice point. And it's going to come up in the little video that we watch. So this little video that we're going to watch talks about all of the benefits of having a transparent way of dealing with data. So just before we play this video, I'll see if there's any other questions. So yes, the slides will be shared. Very happy to share them. 30-second lag on the slides. Sounds efficient to work nationally, but there also seems like there's a risk to the global attack pattern.
Will tell him that a technology company or research study is looking for health data from patients like him. He'll make the choice to donate his personal health information for the greater good. A few months later, he'll get an alert that his data was used to create life-saving solutions or enhance healthcare. A story like this isn't just fantasy. The healthcare system is on the verge of a consent revolution that could change the way medicine works by letting patients manage their health data the same way they manage their bank accounts. But we're not there quite yet. To modernize consent, we need policymakers, clinicians, researchers, patients, and entrepreneurs to get together to build a new platform, one that gives patients the power to control and manage their data. Want to learn more? Check out the report, Your Data, Your Choice, on modernizing consent. And one day, you too might be a part of changing the face of healthcare.
All right, so are we back from the video?
Yeah, I'm not sure what happened there. I think that maybe we went ahead in the slides a bit and it played while you were still talking. So apologies about that. Maybe Chandra, you can just continue.
Yeah, certainly. So I'm not sure how much we got to hear of that. But essentially one of the really big ideas in there is the idea that patients would have access to their own information. So let's say I, as a patient, decide that I want to be in a clinical trial that has to do with the cancer I've been diagnosed with. And then further down the road, it turns out that I'm eligible for participation in other studies, or it turns out that my data would be really useful for inclusion in other studies. I would have, let's say, an app on my phone, or I would be sent an email alert that says, hey, your data would be really useful to us in our study. Would you mind if we use it? And I could engage in this kind of iterative consent process, as opposed to the way things work now, which tends to be either you agree to future research in a kind of blanket way, or your data can never be used again, even if it's very valuable. So I think that there are a lot of opportunities that arise from this kind of reorganization of the ecosystem. So other than that, I see a couple of comments here about risk. So like digital risk, hacking risk, things like that. I think absolutely. As you grow in terms of larger organizations, you end up with a larger attack surface. You end up that you are more at risk than you were previously. But that's in one very specific way. So yes, you have the larger attack surface. Yes, you have the more obvious target. But if I'm thinking about the ecosystem as it stands right now, what we have are a plethora of different kinds of organizations, different kinds of data repositories that have very, very different levels of security and protection. So with one organization, we can really standardize that. Whereas with the current ecosystem, we end up in a situation where there may be data repositories that are just imminently hackable, that have been hacked, that are, very open, and some data repositories that are, utterly protected. So I think that although there are increased risks in one sense, I would say that there are decreased risks in another sense. So as the commenter right below you actually says, so ensuring the data is safe is one of the upsides to this as well as a potential downside. And then last we have institutional policy lag when it comes to supporting data management. Oh my gosh, Andrea, I could not agree with you more. It's actually one of the things that we'll talk about when we get to my suite of tools, is that this suite of tools is intended as a kind of educational resource, but also as a policy development resource. Because one of the things that I found, so the way that those tools, and I'll get into that a little bit more in the second half of my presentation, but the way those tools were developed were that we had McMaster researchers and we had McMaster Research Ethics Board members who really didn't feel comfortable commenting on levels of data security or data safety. They didn't know what to say. They didn't know how to write about it. They didn't know what the requirements were. And we also had McMaster University who wanted to make policies that were based on this kind of thing and didn't have the information that they needed. So when I developed these tools, it was meant to help researchers, research ethics board members, and also administrators. And I thought that that was a McMaster problem. But as I found, as soon as I moved positions and I was then working with Memorial University, it turned out it was also a MUN problem. And I was working with a major regional health authority here, and it turned out it was a health authority problem. And so the more I dug, the more that I found that, in fact, this problem of policy lag and of misunderstanding when it comes to ethical and responsible data management is across the board for big organizations. So one of the things that was brought up in my bio is the fact that I run a working group that's associated with the adoption of my toolkit. And that working group is now 70 member organizations strong. So that includes dozens of universities, of healthcare institutions, of other research institutions. And it's because the problem that you're pointing to is a problem across the board. Oh, and Nancy here is saying it reminds me of the 23andMe DNA process I participated in. They inform me when they use my health data for any. Yes, Nancy. So I have lots of things to say about 23andMe. I'm very interested in ethics and genetics, but you're absolutely right that it is similar to that kind of process where it's modernized. You're being informed when and how your data is being used. And what I always imagine is, wouldn't it be nice if instead of when you participated in a clinical trial, your data, went into a box somewhere and maybe you never heard about it again, or maybe if you're lucky you were sent a journal article you couldn't understand. If instead of that you got an alert that said, hey, your data helped make this discovery, or would you mind if we used your data for that? I think that would be a tremendous value add to the research participants in a number of different ways. All right. So if we have no other questions about the DRI, I will start to talk about the Tri-Council been forthcoming for a long time, Tri-Council policy. All right, we can move to the next slide. And I'll move to the next slide on my computer. Okay, so there's a couple of different pieces of Tri-Council guidance that are currently available when it comes to digital data management. So one, there's the Tri-Council Statement of Principles on Digital Data Management. Two, there's the draft Tri-Council Research Data Management Policy that was open for consultation. So the consultation for that actually closed in 2018. There's also a public consultation summary. So all of the different groups and what they had to say about the draft research data management policy. So as it stands right now, we do have the principles, and the principles are suggestions, let's say. They don't have the same clout as something that's in the TCPS2 or in another regulatory compliance document. However, this is about to change. So we have been promised this policy for a year and a half, maybe more. The deadline keeps getting pushed, and there are a lot of good reasons for that. I was told that it was supposed to be in the fall of last year. That was the last one I heard, and haven't heard anything final since. But I do know from just my community that this is something that is imminent. So that is that instead of being a series of suggestions for here's what you ought to do or here's what's best practices for digital data management and for data management more generally, is there is going to be a policy. And it's going to be required that organizations implement that policy. So for those of you who are familiar, the Tri-Council, so any organization that is capable of administering Tri-Council funds has to live up to Tri-Council policy. So that means that it doesn't matter whether or not the research that's happening at your institution is actually funded by the Tri-Council. So it doesn't matter if your research has CIHR funding or if your research has SSHRC funding. Insofar as you're doing research under the auspices of an organization that can administer those funds, even if your project's not funded, it still has to live up to the policy requirements. So that's sort of a long way of saying that a lot of the research that happens in this country, most of the research that happens in this country is going to be required to live up to the Tri-Agency Research Data Management Policy. And one of the things that's contained in the Tri-Agency Research Data Management Policy is going to be the requirement for a data management plan. So prior to now, one of the things that you would probably be asked about, especially if you're doing research involving human systems, is going to be some basic questions about your data, how you're collecting it, how you're storing it, how you're transferring it, how you're destroying it. A research data management plan goes into all of those same questions about the data lifecycle from collection to destruction, but goes into much more detail. So there are a number of different questions that are associated with this requirement, from what level of detail is going to be required, what support is going to be offered to researchers, what kind of policies are going to be developed at institutions. And one of the ones that's come up for me, especially working in an ethics office, has been, well, who is going to adjudicate these data management plans and figure out whether or not they're appropriate? There are plenty of ethics officers and different people working in ethics who are a little concerned that these data management plans are going to fall onto the plate of research ethics board members, and it's certainly possible. So if we move on to the next slide, I would ask, why do we think the agencies are developing a data management policy? And again, it's a kind of pro and cons question that I'd like to ask here. So a lot of people hear about this new requirement or something that they view as a brand new requirement and are very concerned. Whereas other people hear about this requirement and they're excited. They've been worried about how data has been managed at their institution, and they're glad to hear that there's going to be something that's a bit more formal. So I'm just kind of curious from the room what everybody thinks about this new policy that's forthcoming.
It's Freya here, and I just wanted to let the group know that we're having a Wi-Fi issue on the presentation end. It seems to be a technically problematic day for us, but we're going to continue to move forward with it, and Hope is working on figuring out how to reconnect. So we'll be up again with the presentation shortly, but Chandra, if you could just continue, we'll follow along with your words.
Absolutely. Okay. All right. Well, I can imagine that there's plenty of you out there who are like, oh my God, this is going to be horrible. This is going to be a whole new requirement. And I would say first, this policy is intended to be a phased approach. So it does have 3 pillars. And the first pillar is that your organization needs to have policies and support in place for the researcher prior to this becoming a requirement. So this is being dealt with in a measured way, despite the fact that it could be viewed as something that's a little bit challenging for researchers. So there are a couple of different pros to this policy existing. So the agencies must ensure that the research that they fund is conducted according to the highest standards. That's a requirement of these funding bodies. So by adopting a research data management policy, the agencies aim to contribute to a future research culture that sees strong data management as an accepted signifier of research excellence across disciplines, so that this that we recognize as tremendously important, as opposed to something that we see as a kind of side project. Insofar as that is recognized, there are some great things that come out of that, including allocating funding. So you wouldn't believe how many research budgets I see that have absolutely no funding allocated in them for data management, data storage, data destruction. They don't have anyone who's working on those things. And so this gives you an opportunity to really build that into your proposal. Another pro is that more Canadian data sets will be cited as our data management includes, our data accessibility also improves. So Canadian researchers will be recognized and awarded for excellent data management. So this being something that we recognize not only with our wallets, but also when it comes to research recognition more generally. So it will be more of a valued product of research. Canadian researchers will be equipped and ready to engage in international research collaborations where data management requirements are becoming the norm. So this is one of the things to remember, and I think this is one of the things that helps folks who are a bit resistant to this understand the requirements, is that data management plans are already required for receipt of funding in the US and the UK. So it's also the case in lots of countries in Europe, not all of Europe, but a data management plan is required. So if you're doing international work, if you're working, let's say, on a multi-site clinical trial that has other sites, you're already going to be required to produce one of these. And so Canada is actually a little bit behind the times when it comes to this requirement.
Chandra, it's Freya here.
Yeah.
I just wanted to check and see, are we on the right slide right now? Because Hope has managed to get it back up.
Oh, good. Glad to hear it. So we're a little bit further ahead than that. Actually, I would say, why don't we move on to the video slide?
Okay.
So we talked about a couple of the pros. So the last pro that I wanted to mention quickly was an increased ability for research data to be archived, found, and reused to support reproducibility and the responsible conduct of research, fuel new discovery and innovation. So this is a big one. The way that lots of research data is stored right now is stored and named in such a way that it can never be reused. And there's actually quite an old, but a really great and silly little video that's associated with this. So guys, I'm not sure if you can open this up in your browser and show it to the participants here.
Hi, Chandra, Hope here. I'm going to try my best, but if we all just remain quiet while we do this and put our mics on mute, it might have a better chance of working. Just as a reminder, there is a 30-second lag after I press start, which I'll do right now.
I'm an oncologist. Hello. My name is Dr. Judy Benign. I'm an oncologist at NYU School of Medicine.
Hello, Dr. Judy Benign.
I read your article on B-cell function. I think that I could use the data for my work on pancreatic cancer.
I am not an oncologist.
I know, but I think I could use the data for my work on pancreatic cancer. Do you have the data?
Everything you need to know is in the article.
No. What I need is the data. Will you share your data?
I am not sure that will be possible.
But your work is in PubMed Central and was funded by NIH.
That is true.
And it was published in Science, which requires that you share your data.
I did publish in Science.
Then I am requesting your data. Can I have a copy of your data?
I am not sure where my data is.
But surely you saved your data.
I did. I saved it on a USB drive.
Where is the USB drive?
It is in a box. It is in a box at home. I just moved.
But can I use your data?
There are many boxes. So many boxes. I forgot to label the boxes.
Hello again. Thank you for sending me a copy of your data on a USB drive. I received the envelope yesterday.
You are welcome, but I will need that back when you are finished. That is my only copy.
I did have a question.
What is your question? You might find the answer in my article.
No. I received the data, but when I opened it up, it was in hexadecimal.
Yes, that is right.
I cannot read hexadecimal.
You asked for my data and I gave it to you. I have done what you asked.
But is there a way to read the hexadecimal?
You will need the program that created the hexadecimal file.
Yes, I will. What is the name of the program?
Cytosynth.
I do not know this program.
It was a very good program. The company that made the program went bankrupt in 2007.
Do you have a copy of the program?
I do not use this program anymore because the company that made it went bankrupt. Maybe you can buy a copy on eBay.
I have good news.
You again.
I talked to my colleague. She knew a person with a copy of the software.
Then why do you need me? Everything you need to know about the data is in the article.
I opened the data and I could not understand it.
If you have the program, you will find it is clear.
Well, I noticed that you called your data fields SAM. Is that an abbreviation?
Yes, it is an abbreviation of my co-author's name. His name is Samuel Lee. We call him Sam.
I see. And what is the content of the field called SAM1?
Ah yes, SAM1 is the level of CXCR4 expression.
And what is the content of the field called SAM2?
That is logical if you think about it.
What is the content of the field called SAM2?
I don't remember.
What about SAM3? Is there a guide to the data anywhere?
Yes, of course. It is the article that is published in Science.
The article does not tell me what the field names mean. Is there any record of what these field names mean?
Yes. My co-author knows what the content of SAM2 is, and SAM3. And
Okay, the video seems to have stopped.
Use your data.
you could check the article to see if what you need is there.
Please stop talking now.
Hi, Chandra. We
Hello,
ended
Neil
the video now.
Armstrong. How
Hi, everyone. So I'm sure that video is not as hysterical to others as it is to me, but every time I watch it, I honestly laugh out loud because it's so accurate to the way that people care for their data. So the idea that there would be a USB drive in a box somewhere unlabeled, the idea that the information in it would only be, you know, understandable by people who work directly on the project, the idea that Sam Lee moves back to China and we don't know how to contact him, all of those things are things that I have seen. So taking that responsibility for effectively and efficiently and meaningfully organizing your data and providing support to people to be able to do that, I think is a tremendously important part of the policy and the organization that are cropping up around this. So I see that there are a couple of questions here, or a few different comments, really useful. So the idea of providing guidance to researchers to allow for standardization being tremendously important, and to standardize a process to reduce cycle time being very useful. Comment here we have is faculty members don't all embrace the need to manage data. And I absolutely could not agree with you more. It's one of the things find very, very challenging is there would be pockets of literacy when it comes to ethical and responsible data management, and pockets that are really, really resistant to it. That's part of the reason why we developed the toolkit that we developed, is that it is intended for an audience that's not exactly tech literate. So it's meant to be used by a wide variety of people. And when we're talking about researchers, it's such a various community that you really need something that lots to make use of. So I think now we'll move on to slide number 28 titled, slide number 26 titled Data Management Plan. So on the next slide, after that title slide, we talk here about a great data management plan. So one of the things that's going to be required by this new TCPS2 policy is that researchers produce a data management plan, and researchers don't always feel supported in being able to do that. So the tool that I recommend using, and that lots and lots of universities and other institutions are adopting, is DMP Assisted by Portage. So this is essentially functions much like a fillable form, where you have questions that will guide you in the information that you need to provide to have a robust data management plan. So, you know, how and when will your data be gathered? How will you keep it secure during that time? It also provides instructions and suggestions for good answers to those questions. So really, really useful, really helpful tool. And it contains a number of different categories that include data collection, documentation and metadata. So how are you storing your data so that somebody might be able to use it again? Storage and backup, preservation, sharing and reuse, responsibilities and resources, and ethics and legal compliance. So this is one of those great tools that's there to support researchers in providing a really, really useful data management plan. So next we've got a title slide that says Data Management Toolkit. So now what I'm going to do is I'm going to talk a little bit about the Data Management Toolkit. And actually, I'm wondering if maybe, all right, we'll see if we'll go through some of these slides, but some of these slides we will skip over just in the interest of having sort of a more general conversation about this toolkit and why it's useful. So the first tool that I want to present to you is that Portage tool, which we talked about. And so I had nothing to do with the creation of that tool, but I am the person who created the following 4 tools. And as I mentioned, we have a working group that's working with all the organizations that are currently implementing these tools. So starting with the problem, so the slide marked the problem. So when I was finishing up my PhD, my field is biomedical ethics, and responsible data management was an area of interest for me. But I was also sitting on the McMaster Research Ethics Board. And one of the things that we found was very, very challenging was there was a section of our application that we called Section 25. And Section 25 was a section that asked, how are you going to collect your data? How are you going to store your data? How are you going to transfer your data to your colleague in another institution? And what we found was that while we went back with comments on lots of other areas of the application, we went back to the researcher with a ton of comments, a ton of questions, a ton of suggestions on this section in particular. So this was obviously causing trouble for researchers. But furthermore, we found that it was actually causing a lot of trouble for research ethics board members. So that research ethics board members were saying, you know, I don't know, is storing your data in a password protected personal laptop under your bed appropriate? If not, why not? What kind of suggestions should we give? So it wasn't only that the people filling out the application were having trouble answering these questions, the adjudicators didn't feel like they were in a position to be able to appropriately adjudicate the application. So as a result, I was hired to build some tools that were meant to improve the level of literacy that was associated with data management. And so on to our next slide, we have a slide marked the solution. So we developed broadly accessible digital data management education and policies tools. These resources are based on extensive research, including an original qualitative research project with McMaster University. So that was one of the first things that we did, is we wanted to know, well, what kind of questions do researchers have? What kind of questions do research ethics board members want to ask? So we did qualitative, semi-structured interviews with researchers as well as research ethics board members. And we took the questions that they had, the information that they needed, and we used that to build the tool. So we didn't want to start blind by creating a solution to a problem we didn't understand. We started by really trying to understand the problem. So in addition to that research project, we also engaged in an extensive literature review and environmental scan. So this was to understand, what sort of data management policies were already out there, what sort of data management regulations existed, what sort of legal obligations did people have to live up to. So all of that information informed this suite of tools. So the next slide, we have a list of the research data management tools. So those include a digital data management glossary, a digital data management frequently asked questions document, a digital data management matrix, and a digital data risk matrix. So we'll talk about each one of these in turn, starting with the digital data management glossary. So we can move on to the next slide. So the digital data management glossary, we took a great deal of information from CODATA as well as CASRAE. So some of you might be familiar with these organizations. CODATA is the Committee on Data for the International Council of Science. It has a Canadian arm. And CASRAE is the standard dictionary of research administration information. So one of the things that CASRAE does is it tries to come up with a shared vernacular for basic research administration terms. And they actually had a sub-dictionary called RITHIM that was focused on data and data management. And so a great deal of the definitions that we put together drew from information that was collected from both of these resources. So if we move on to the next slide, you see that there is a sample definition. So I provided the definition for a data management plan. So we give definitions that look like this. So a DMP is a formal statement describing how research data will be managed and documented throughout a research project. Almost all DMPs contain the following core elements, and we list them. And then after that, we say McMaster encourages the use of DMP assisted by portage, a bilingual tool, and so on. So you'll see that in our sample definition, all of our definitions have two components. So that is the initial component where we provide a general definition. So here, generally, is what a data management plan is. And then the second component is the one that's there to be updated by your organization. So in the adaptable set of tools, this information is highlighted and it's intended for you to change it, so that you can take this information and adjust it for your organization. So you can say, our organization recommends the use of this tool, or our organization wants to draw your attention to this policy. So really, all of these definitions have two different components, a general one and a localizable, contextual one. So in the next slide, you can see a couple of the sample terms. So some of the terms that we've defined in our glossary include cloud services, data lifecycle, data management plan, data security, data sharing, data identification. I always joke you can tell that I pulled these from the D section, but it goes on, and there are several of the most used terms that are present in our glossary. And we've made a real effort to make those as understandable and clear and straightforward for a broad audience as possible. All right, so the next one we have is data management FAQ. So one of the things that we did after we did our original research was we amalgamated all of the top questions that people were asking. And there were a couple of questions that came up time and time again, whether it was from research ethics board members or from researchers or from other kinds of administrators. So some of those questions include, is a password protected laptop a secure place to store my data? How long can or should I keep my data? What is encryption? When and how should I encrypt my data? What is cloud storage? Is it safe to store my data in the cloud? Is it safe to store my data on mobile devices such as cell phones? What's the difference between wireless and wired connections? What online survey software should I use? And what's the best way to share data with my co-investigators? So you can see in the next slide, we have the ethical data management FAQ. Is a password protected laptop a secure place to store my data? And one of the things that you'll notice is we talk there about a couple of different things, and we divide low, medium, and high risk data because the recommendations are going to be different for the different levels of risk. And as you'll notice on this slide, low risk, medium risk, and high risk data are actually underlined. And part of the reason for that, and I'll talk a bit more about this, is that these tools are intended to function together. So when those tools go live, those underlined sections become clickable links, where let's say you want more information about what is low risk, what is medium risk, what is high risk data. You can click on those and they'll take you to the glossary to give you a definition. Or you can click on those and they'll take you to the management matrix, which will provide you with a suggestion for how to manage the data. So these projects are really meant, these tools are really meant to function in an interconnected way. And then if we move on to the next slide, you'll see there's a suggestion for storing data on a portable storage. So it talks about the risks that are associated with that. And we go on to provide more information about how to effectively manage your data, even if you are using a personal password protected laptop. So there's information here in this slide about things like basic computer and basic digital hygiene and how necessary that's going to be if you're using your own personal laptop. And so as you can see here, we'll kind of just cycle through some of these slides and we'll disseminate these slides so that you have more information. But we have further FAQs and they're provided, we provide information in as digestible a way as possible. So we'll provide pros and cons for using one kind of technology over another. We'll provide suggestions for the kind of technology that it makes sense to use and when. I would say from there, let's move on to slide 53. So that is Research Data Management Matrix is the name of that slide.
Chandra, it's Freya here. I just wanted to hop in and say that in the comment section, Hope has provided a link. So if you want to follow along on the presentation that way, people will be able to access it that way.
Oh, excellent. Thank you very much. All right, so moving on to slide 53, the Research Data Management Matrix. So I've already talked to you about the glossary. So the glossary provides you with basic definitions. It provides you with general definitions as well as a localizable section. We then have the FAQs that covers the most frequently asked questions that are associated with responsible data management. And from there, we have the Research Data Management Matrix. This is probably, in my experience, the most popular of the tools. So this one, you'll see along the top here, we have sections for low risk, medium risk, and high risk data. And then along the side, you'll see we have types of data. We have a list of examples of each of those types of data. And from there, you can see we have data protection. Actually, this continues down the page, so you won't see it in this presentation. But there are sections along the side there for every stage of the research data management process, from collection through to destruction. So, for instance, if I had medium risk data and I wanted to know how to destroy it, I would follow along from the destruction section, follow along from the medium risk section, and that would take me to a concrete suggestion for how to responsibly destroy my medium risk data. If I want to know how to protect my high risk data, I'm going to follow data protection over to high risk, and I'm going to have a tangible suggestion for what to do next. So the nice thing about these tools operating together is that if I am a researcher who just needs a basic piece of information, if I'm a researcher who just wants to know, just tell me how to get rid of it, just tell me how to store it, you can use the Research Data Management Matrix and you can get that little piece of information, store it in a locked office in a filing cabinet, or store it on a personal password protected computer that's encrypted. But if you'd like more information than that, then that suggestion will be full of clickable links, like, well, password protection might be clickable, encryption might be clickable, cloud storage might be clickable, and you can follow that to the FAQ document, to the glossary document. So if you're the kind of person who wants to dig down, who wants to know why, if you're the kind of person who wants to learn more about ethical data management, you can dig down as deep as you want. If you're the kind of person who wants an immediate suggestion for how to go about taking care of this data, then the Research Data Management Matrix will provide you with that. And so in our next slide, you can see we talk about low, medium, and high risk data. So the next slide is low risk data. We provide some examples of that, so things that don't contain sensitive or identifiable information. Also, if in doubt, assume that data is sensitive. That information is all over our tools. So we provide some examples of low risk data, such as completely de-identified or anonymous data, depending on its content, blank consent forms and information sheets, public facing information, all very low risk. The next we have is medium risk data. So for instance, research that may or does contain sensitive information, de-identified records of compensation is something that would be medium risk, something that might have intellectual property implications might be medium risk. And we provide some examples there, like video or audio recorded interviews, depending on the content, identification keys, depending on the content. The next we have is high risk data. So we've got some of that. So personal health information is going to be high risk. Personal financial information is going to be high risk. And the examples that we talk about here are information with regard to racial or ethnic origin, political opinions, religious beliefs, anything that could put the research participants at risk. And next we have the data life cycle slide. So again, those are all the different stages of life that we talk about in the Research Data Management Matrix. So where we talk about data collection, we talk about data access, we talk about data storage, we talk about data transfer, and data destruction. And you'll be able to have suggestions for each of those stages, no matter what level of risk is associated with your project. So there we have one more image in the next slide, slide 62, of the Research Data Management Matrix. And you can see in this image a couple of the terms are underlined, and those provide clickable links. So they interface with the other tools. The last tool that's available in the toolkit on the next slide is the Research Data Risk Matrix. So this is one that we found was very, very valuable for researchers, because insofar as there are many researchers who just want to know, just tell me how to deal with my data, there are also plenty of researchers who want to know why. Why do I need to do this? What is at risk? What am I preventing? What am I protecting against in doing this? And so we have a risk matrix that talks about risks to different groups that are associated with research. So what's the risk to research subjects? What's the risk to researchers? What's the risk to institutions? What are the risks to the data itself? And how do you manage the risk? And then we have, and you can see here, a couple of them listed, like unauthorized data access or confidentiality breach. But we have some common issues, some common risks that are associated with data. And then we talk about how those risks affect each of these different populations or each of these different groups. So how would unauthorized access to data affect research subjects? How would unauthorized access to data affect the institution that the data came from? And this really helps researchers who are having a hard time understanding why so much is being asked of them by demonstrating to them what could happen if things go wrong. So now we'll move on to slide 67. So slide 67 talks about the connection between the tools. So I've already mentioned that, but essentially throughout each one of the tools, there are clickable links that connect you to the other tools. If you have further questions, or if you've been told that you need to engage, a cloud storage platform and you don't know what that means, then you can click on it and get a definition. And this is one of the things that's most useful about the tools. For your interest, if you go to the next slide, samples of the tools in action, you can see McMaster's version, you can see Mung's version, and there are several other versions in various stages. So the next slide, we have the objectives. So this, I just wanted to give you a reminder of everything we went over today. So first, we talked about Canada's data management landscape. Particularly, we talked about the new NDRIO organization that's going to be overseeing a lot of the data management ecosystem. We talked about the TCPS2 data management requirements. So we talked about how things are changing with regard to policy and what's going to be required of researchers, specifically data management plans. We talked about what a great data management plan looks like, and specifically we talked about the tool that was created by Portage, DMP Assistant, which is really, really useful in guiding you through that process. And finally, we talked about My Data Management Toolkit, which can be updated and customized for your organization if you choose to use it. So the next slide here has my contact information. I want you to get in contact with me if you are interested in any of this. So I've asked for people to get in contact with me in order to use the toolkit. So I haven't made them completely publicly available, but they are available if you ask. And so the reason for that is because it gives me an opportunity to invite you to the working group. So the working group is one of the things that's been tremendously useful when it comes to the adoption of this toolkit. So essentially how that happens is that I would give presentations like this one. And after the presentation, I would have a dozen people come up to me and say, oh my gosh, my institution needs this, my organization needs this, can I have a copy? And I would hand out copies, and then I sort of wouldn't hear from that person for a while. And then, you know, a month, 2 months later, I get in touch and say, hey, you know, how's it going with the adoption of the toolkit? And inevitably, the person would say, oh, well, it's solved, you know, IT wasn't happy about it, or legal wasn't happy about it, or I couldn't get a hold of the VP research, or something like that. And so what I decided to do was say, well, we now have, you know, 10 organizations who are all currently in the process of trying to get these tools adopted. And they're all, you know, running into their own issues, running into their own roadblocks, or in some cases, they're doing a great job and things have gone along swimmingly. So we created it as a kind of support group for people to be able to talk about, well, you know, what did you do right? What did I do wrong? Who should I talk to? Who should I call? What are my learnings from this? And it's been tremendously successful, really, really supportive. And one of the things I mentioned in the beginning was that we now have 70 member organizations that are associated with this working group. So that's 70 organizations currently in the process of adopting these tools and currently facing all of the issues that come along with getting the right people in the room to make this happen, or with customizing them, or improvements that could be made to them. So if you have an interest in this toolkit, if you think it will be useful to you, I encourage you to get in contact with me. I'll provide you with the toolkit no matter what. You can take it and use it and run with it, but I'll also provide you with an invitation to participate in the working group if that's of interest to you, just so you have a bit of a support system when it comes to making this happen for your organization. So I think that about does it for my presentation today, but I'm happy to take any questions, comments, suggestions that come from the folks online.
Thank you, Chandra. It's Freya here. I would just encourage anyone who has any questions, if they want to, please use the chat function right now while we're wrapping things up. And then we can have the opportunity. But also, thank you, Chandra, for providing your contact information. I'm sure that you'll have lots of people interested in following up with you. I'd also like to say that we, Hope and I are available if anybody else has any questions related to RITHIM or related to the tools in any way that we can help. You can get our contact information just off the RITHIM website. And if you haven't checked out the RITHIM website, please do so. It's rithim.ca, and it's got lots of background information on that initiative and where it's at. So I don't know if I see any questions. There we go.
I don't see any questions, but I do see a lot of hilarious comments about the video. So I'm glad it landed.
I do see one, or I see a few comments towards the bottom, Chandra.
Yeah, so we've got one here that says, so from the video, it's as hysterical to us. I've experienced every one of those things from Heather T. Heather T, I totally feel you. Please tell me this was not a conversation that took place in real life. I'm not sure if it was, but it could be. It really, really could be. I think I've heard just about every one of those before too, especially the field called SAM 1, SAM 2, and SAM 3. Like, it gets me every time. And then on Portage, so this is referencing the DMP Assistant. Absolutely, they offer that. It's currently free. So it's not free if you're, or from my understanding, it's not free if your organization wants to adopt it organization-wide. But if you, individual researcher want to make use of it, it's available to you right now. So DMP Assisted by Portage, really, really great tool. control vocabulary, you speak in my library language, absolutely. So I'm often the only ethics board member in a room full of librarians. It was one of the nice things about getting involved in this community was I sort of felt out here in ethics land that I was kind of on my own and that nobody cared about data management and nobody was focused on it and nobody saw the risk. And then I got involved with Carl and the Libraries Association and met these librarians who'd been working on this for decades. So it was kind of like I found my people. It was really great. So yeah, I think that's the end of the comments that are available online. Hopefully folks found this useful, and I'm happy to disseminate the slides as well as the toolkit from the slides.
There are a few other questions. I'm not sure if you can see them. One is who from Manitoba is part of the working group? And
so there are a number of different folks who are part of the working group. So there are representatives from Research Manitoba in the working group. There are representatives from the university of the working group. And if you want to get in touch with me privately, I'm happy to provide you with that information. So one of the things that I've done with regard to the working group is often it's the case that sort of one person from Dalhousie University, say from the library, will hear about this and want to get involved. And then another person, say from the Research Ethics Board, will hear about this and want to get involved. So when that happens, I hook those two people up. So sometimes it's the case that there's only one representative from an organization, but more often than not, there are multiple representatives from an organization. So if you're a person in Manitoba and you want to know if your organization has representation on the working group, get in touch with me and I'm very happy to put you in contact with any of those people. And we found that that's been very, very fruitful because often there are people complete opposite sides of the organization who don't realize that they have really shared interests when it comes to this kind of thing. There was a great example of that with a college that had a professor who was a part of the group and then had an upper level administrator who was part of the group, and they really didn't know each other and had an opportunity to get to know each other and develop projects together because they had so many shared interests. So really happy to provide you with this.
That's great. There's another question here that asks, how is the working group working with the various portage working groups who are supporting this area?
Really, really good question. So I sit on the Portage Sensitive Data Management Working Group. So my group, unfortunately, is actually, we talked at one point about transferring my group into a Portage working group, just one of the very many working groups that they have. We decided not to do that for a number of reasons. One of them being that my group is much, much bigger than any of their working groups. Their working groups are very small and focused. And so we aren't actually a Portage working group, but we do have intimate contact with the Portage working group. And in fact, I was just on the Portage Sensitive Data Management Working Group call right before this presentation, and they're in the process of amalgamating my glossary with a glossary that they've been developing, as well as updating a version of my management matrix. So we're hoping that we're going to have Toolkit 2.0 in the near future, and that Toolkit 2.0 will be in direct partnership with Portage.
Okay, great. Thank you very much, Chandra.
Certainly.
All right. If there are no more questions, I would just really like to thank Chandra for joining us today and for sharing her expertise and her toolkit. I think it's really helpful for us to understand all the work that has been done, and hopefully we can continue to work with you as time goes on. I'd also like to thank Chandra and all of the participants for bearing with us through our technical difficulties today. I know that it can be really distracting and annoying to be on a webinar that isn't functioning technically well. This was our first time with a new app, and it's our first webinar that we've run. So hopefully you'll be willing to come back when we do ones in the future. I promise we won't have as many difficulties. And I'd also like to just quick shout out to Hope, who's the rhythm special assistant, who really was troubleshooting and doing her best to manage a time lag and keep up with the presentation. So she did a great job. Thank you very much for that. And again, if anybody has any questions, please feel free to reach out to myself or Hope or Chandra. Chandra, thank you so much.
Yes, thank you all so much. It was great. I love talking about data.
Oh, there's one more question. I don't know if you want to answer it quickly before you go that I see.
Okay.
Is NDRIO considered to be data sharing at the national level, with Dataverse being for data sharing at the international level?
I think that's a really good question. I think the way that Dataverse and the NDRIO organization the way that they will relate to one another is going to be something that evolves over the next while. So I really think they are trying to fold in a lot of those kind of processes and procedures, but Dataverse is kind of its own beast. So it wouldn't surprise me if it ended up falling in exactly those kind of categories, where NDRIO is really focused on, you know, the national moving to local, and Dataverse has its own special and particular role to play in the international kind of community.
Okay, great. Thank you so much, Chandra. Thank you, everybody who joined us today. I really appreciate it.
All right, thanks all.
Bye.
Bye.